Oh, good morning. That was quick. Accidentally popped the thing on. Oh, it's nearly 4. Oh, it's almost 5 o'clock. I'm having my coffee. Somewhere it's bedtime for someone. So let me have a sip of coffee here. Says we popped this thing on so fast. I wasn't ready. Mmm, that's pretty good. Still hot. Okay, this video is going to be about fenbendazole and ivermectin. It's kind of like, you know, I've read a lot about this stuff from people posting online, and it's kind of frightening when you see the amounts that people are taking and calling it protocol and what's being sold, and is it real, is it this, is it that. Listen, everything is good. Holistic is good. Holistic is just as good as chemical, regular pharmaceutical, if that's what you want. But I like to be very careful what I do to my body because it's my body. I mean, the reason why I would take something like this is to preserve my life. I don't want to take something like this and destroy my liver or my kidneys or something and kill myself in the process, because then why bother, right? So I was reading in here, and I got a book. I ordered it online, and that's one of many, but this one I was just starting to read protocols for the Ivor and Fenbid, because I see where people are taking big doses of these things together. And for years I've bred animals, dogs, and if there's one sure way to kill an animal, it's by giving them too much hormone. And it goes by weight. It really does. It goes by weight. It's the same drug is going to do the same thing in the right amount as it would be if you overdosed them, because it goes by body weight. So I was looking in here, and on the Ivor side, there's probably different protocols or something that they're calling for different cancers and stuff like that. But it's very mild. I think one thing that I had heard was to take, when we did the math, it was like 70 milligrams a day for like 3 months or something. It's some insane amount. And I said to my friend, how could anybody even afford something like that? You might as well go down there and get the chemo or whatever they're offering that the insurance pays. At least try to do something to save your life. Could never afford all that money. Oh, Lord, you and me. But really, it's not that difficult. One of the things that I've read so far, which is more in the line of what I had thought, would be like there's 3 different pulses they do. They do a pulse run, or they do different clinics, because they're doing a lot of research now, and oncologists are incorporating it into their treatments because of the ability to inhibit the growth cells in the cancer. So one of them was to do 12 to 18 milligrams a day for 3 days consecutively, and for what was it, for 5 weeks or 4 weeks, and then stay off of it for 10 weeks or something like that, and then go back. I'll have to read it and be specific about it. But if you ask me, I'll get you the specific information. Another one was to go like Monday, Wednesday, Friday with like a 12 milligram in addition to whatever else you were doing. And then the other one was, what was it? It was, I think it was 12 milligrams a day for 5 days. And then, let me see. It's really, it's just a lot of things to remember. You know, and it's, when you're starting to do these things and you're listening to all these people online, they kind of scare you because if you start taking it in these mega doses, you're really not helping yourself. You know, you're actually hurting yourself. But they mentioned Joe Tippin's protocol in here and stuff like that. I mean, it's a good book. It's, oh, can you read it? And I read the protocols. There's the doctor. And he does his studies. He's an oncologist. Okay. But one is just pulse therapy. They call it a pulse therapy. And it's so low peaks and short bursts, okay? So you do like 24 to 30 milligrams once a day for 5 days. And then stop for 10 to 14 days before repeating the same thing. Okay, that's one strategy. Another is, they call it weekly dosing, where you, with your oncologist, this is oncologists in the United States, the typical plan is a single 12 milligram tablet every Sunday with breakfast, paired with your liver function test once a month. Okay? And then the other one was the one where it came out to an average person 12 to 18 milligrams for 3 consecutive days, or else on Monday, Wednesday, Friday. It wasn't a lot, because see, then you also taking some other stuff with it. Now, but Ben, I haven't seen them go up into these outrageous numbers like the people. It's just the gram. It's the 222 milligram packet dose. It's not 444 or twice a day or really outrageous numbers, but that's, I mean, something I guess it's up to everybody. But what happens if you start poisoning yourself? You ruin it for everybody else who's going to follow, you know, a doctor's protocol, and maybe have a chance to do some alternative medicine for themselves, some holistic stuff. But the more I research, the more I will share, because I told you I have a new beast. My new beast is the hardening of the boob. That's what we call it at our house. I haven't gone for the MRI. I definitely will not go for a biopsy, because I feel if you pierce it, you're going to spread it. I will not go for a mammogram for the same reason. I'm not going to smash it and have it pop like a pimple and go throughout my body. God made my body to where it encapsulated whatever it is, and I have to deal with keeping it from growing. I have to feed it what it is going to get fed to destroy it, or I have to feed it what it wants to keep it tame and live with it. People live with goiters and tumors all the time, and it's just the way that I'm approaching it. And I may not be alive next year. It may turn out that I went the wrong way, but at some point I may decide to do something different. But this was so fast, and the growth came so quickly. It went from being little marble-sized knot, to being like a mushroom on the whole breast nipple area, you know. I don't know if you're supposed to talk so blatantly blump and these, and say all these words and, not even weird little nicknames like, the brownie area or something. I don't know. So I'm all new to this. I just know that there's a lot of people out there struggling with it. Me, I'm on oxygen, so it's just everything I do is slow. I say haste makes waste. I always have. Every time I did anything hastily, I generally got in some trouble and I lost something or something went haywire. So I try. Excuse me. To remember that when I approach things in my life, because it is life. It's my life, and this is my life right now. Of course, I would like it to be more, be different, and go back to the way it was. But this is what I have right now. This is it. This is what I'm dealing with. So, I'm going to work at it as much as I can, but being on oxygen and being home bound, more or less, because of the flow rate of oxygen I have, I did get a wheelchair, so I'm going to be able to get out. And not that I can't walk, I can walk. It's just when I stand up and I move around too much, my oxygen levels drop and I must sit down. And it's the only way I'm going to get up to my doctor's is in a wheelchair. And I don't go into stores because I can't walk around, and so that's stopped me from doing a lot of things. I need to go have my teeth fixed, but that's from another drug. Prednisone destroyed my teeth. It's destroyed my hair. It's doing a hell of a job on my bones and my skin too. I'd love to get off of that drug. Maybe in stumbling around with this boob thing, I might find an exit from that prednisone. But I did read that helps keeping the tissue down from swelling in the tumor area. So, there you go. I can't get rid of it again for a while. I do have plans to go to see my pulmonologist. And he's going to be very frustrated with me because of my decision. He was very frustrated when I refused to take the COVID vaccines. And I never did. I stood firm. And it just drove him absolutely out of his mind. But I had COVID 3 times and it didn't kill me. I treated it with ivermectin and antibiotics. And I lived. The first time I had it, I treated with nothing. And the first COVID was when it first came out in 2020, over Christmas and the New Year's. My grandson and I had, and we never got rid of it. It was horrible. They wouldn't test us. There was no test. I was too old. He was too young. We were just sick, with thick, strangling mucus. And it came from your sinuses, and it would just kill you. It would kill you. You couldn't get it out. But we lived. I had it 2 other times. Each time was better. When I went to the hospital, thinking I had exacerbations, I found out I had COVID. And they to kill me by not giving me my medicines because they said they didn't want to do aerosol, like nebulized medicines, because it might put it in the air. Well, that's the only way I do my medicines, so I told them, you gotta let me out of here. And then they wanted to give me that medicine that causes the blood clots and stuff. No, I'm a patient that a hospital can make a lot of money on if I'm on one of the ventilators and stuff. So I have steered clear from hospitals since that day. I only go in that emergency room if I absolutely, positively cannot breathe and I can't pull myself out of it. I do not trust them. It's a business. I am just another patient with a bigger dollar sign because of all the things they can charge. So, having said that, my doctor was crazy because I wouldn't take the vaccine. But I told him, I know my body. I know the vaccine will kill me. I don't move around enough. I will get blood clots. I put on so much weight from the prednisone. I will get blood clots. I will have a heart attack. I will die. And he just thought of it from a different angle, I guess. So, I mean, he's gotten over it because I lived through it, and now this. This is a whole. He's an internist. You know, this is his deal. He's dealt with a lot of patients, and I'm sure he's going to have a lot to say, but he's really good, though. He does listen to me, and he tries to do whatever he can for me. So that's who I'm going to go talk to first. I do like my primary doctor, though. He was very fair. He set me up for everything. He wants me to talk to a surgeon, even though we know that because of my oxygen levels in my lungs, I can't go under anesthesia. They can do it, but it's very dangerous. So some type of an operation like that, I don't want to die, and I don't want to die sick, like agony. For you on and on, you're just miserable, sick. I don't want to kill myself quick by doing something like that and then you just die. I want to wake up when I wake up and go to sleep when I go to sleep. And if I don't wake up one day, so be it. But I kind of trust God into knowing when that time is. That doesn't mean I'm not going to try to feed this beast or get it out of my body because it doesn't belong in my body. I not sure what could have caused him, but I'm going to keep researching, and I might sound like an idiot, and I guess I do to some people, but I don't know. God's carried me through this far. I'm gonna trust Him and hang in there. Now I do have to go get my eyes done. I've got to get these little things removed off because this pre-diabetic situation is from the prednisone of the drugs I take for my lungs. So I have to watch that. And I have to deal with this beast on my boob. Not very intriguing. Not my ideal of a party. But we'll do it. The hardest thing is to get not to have sugar, because I love my cake. I like to have cake. I could probably do away with most all other sweets, but I like cake. I don't even need icing on it. I just want a piece of cake or a plain donut. To me, that's such a treat. But they say you gotta really cut out sugar, so I use stevia for the most part. And my daughter, she's learning to make cakes and stuff with stevia. She's working on it. She's my best friend. But she makes these really great peanut butter stuffed dates covered in chocolate. So we're gonna sweeten that chocolate with stevia and see. Also gotta loose sugar. Beet sugar doesn't spike any sugar, so should be okay. Anyway, so this is where I'm coming from right now. I'm going through this book. I'm trying to find some things that I want to know. And I belong to some groups, and people are always asking for answers. And I read the things that other people are telling them to do, and I think, oh my gosh, I don't think that's right. I'm not going to take 70 milligrams of something a day and blow my liver out. Not me. So, even if it required 70 milligrams a day, guess what? I'm not going to take 70 milligrams a day. I'll go out there and eat grass first. And then, you know, the black walnut, is quite an effective anti-parasitic, and it may have some of the same chemical compounds that treat the body the same way as these other anti-parasitic drugs that they're using with cancer. So, I mean, there's all different kind of alternatives that you could try. Like I'm drinking right now mushroom tea. It's very good. It's reishi and changa tea, but mixed with dates and all different kind of stuff. It really gives it a nice twist. But it's like a coffee made with chicory. But yeah, I try to do a little bit of something good, something helpful, something beneficial, and everything I kind of put in my body. Today I had my daughter stuff capsules, pill capsules with reishi powder and papaya leaf powder, and she did a great job. We had the wrong size capsule for the stuffer, but we're going to correct that. So, Grammy says, don't feel down and don't feel out. Get up. Take control of your life. Stay in if you want. Go out if you want. But don't take somebody's word as the last word. Not even your doctor's. Put it all in a basket. Then do yourself some research and take it out of the basket one by one. See what fits you. If you take something and it doesn't feel good, take half of that amount and see what it does. You know, feel it out. It may not be for you. It may not be for you. So, just be happy that you can do it. Be happy that you're still here. Put it in God's hands. Turn around and have a nice day. So on that note, I'm going to say good night to some of you because it's bedtime. And I'm going to say good morning to some of you because you're just waking up. And the rest of you that are out there already, have a nice day. And don't forget what Grammy says. Because Grammy said it. Doesn't mean it's true. Bye, y'all.